Infectious disease expert Dr. Zain Chagla joins us to discuss the latest updates on the pandemic and vaccinations. Happy Friday the 13th.
Hi, good morning, Bob.
Good morning, good to see you. Ontario reported 513 cases yesterday. That's going the wrong way. Dr. Teresa Tam says we are in the fourth wave, but can you give us some perspective here? Vaccination status is an important factor, isn't it?
Yeah, and Ontario is doing a really good job now reporting this out for every case. And when you see vaccine status, again, people will get COVID who have the vaccine. We saw that even in the clinical trials. But the percentage of people that are getting COVID-19 that are unvaccinated relative to the percentage of the population that's unvaccinated really is astounding, right? You see about 8 times higher people getting COVID-19, average for the number of people that are unvaccinated versus vaccinated. So 8 times the number of people that are unvaccinated getting COVID-19 as compared to those who are vaccinated. And really, that's what we're worried about most in the healthcare system, is those unvaccinated people that are going to end up in healthcare at some point, especially some of the older ones. And it's so much more important that people get vaccinated now, as again, it's not going to be easy for unvaccinated people to be shielded amongst vaccinated people.
Yeah, you actually, you probably don't have them in front of you, but I've got them here that you posted on Twitter in terms of efficacy: 87.5% against COVID, 94.7% against hospitalization, and over 99% protection to keep you out of the ICU. So the numbers say it.
Yeah, I mean, there are two people in the ICU that are fully vaccinated. Two. Yeah. In the whole province of 14.5 million people, right? And it really does say what these vaccines did. We remember in our third wave, there were over almost 1,000 people in our ICU. There are 2 now in our ICU that are fully vaccinated. And it just spells the importance. We're hearing a lot of controversy about how well these vaccines work. They work incredibly well across all data sets in keeping people out of hospital. And again, healthcare is a public resource. There are limited beds. It's up to all of us to make sure that it's preserved going into the fall.
And also important to protect the vulnerable, because right now in the States, we're seeing a huge spike in pediatric cases because of a low vaccination rate in COVID hotspots. Thankfully, we don't have that here, but that's an issue, isn't it?
Absolutely. I mean, I think, again, you're seeing just huge levels of transmission in places like Florida and Texas. And kids are the largest unvaccinated group, particularly those under the age of 12. The good news is the vast majority won't get sick. But, if you have a huge number of kids infected at any given time, and there is a certain percentage that will go on to get sick and have complications, your number of kids overall who get sick and have complications is going to grow. And so, we obviously don't want that type of uncontrolled spread here. And knowing that in a month we're going to have kids back at school, which is a huge unvaccinated population that's interacting with each other in large group settings, it's really, really upon us to be as careful as possible. And again, for everyone around those kids to vaccinate who's eligible.
Do you think we need vaccine incentives in Ontario?
Yeah, I mean,
and across the country.
I ran the numbers the other day. If you took 5% of the unvaccinated population and said that they were going to get COVID in the next 6 months, and you then said about 1% of those are going to get in the hospital, and 1% of those are going to need an ICU bed, that is something like $100 million in healthcare costs. Well, if you took 10% of that money and put it aside and gave an incentive for people to get vaccinated of that 5%, it would be something like $100 a person, where you'd save $90 million in the healthcare system where they're not going to be represented within, right?
Sounds like a no-brainer.
Yeah, exactly. I mean, people don't obviously feel great about giving money to people to get vaccinated, but at the same time, we have a publicly funded healthcare system. It is so much more cost-effective for people to be vaccinated and not represented in the healthcare system as compared to
it gets us to the finish line.
And it gets us to the finish line. It gets us to normal. It keeps us well through this year, right?
Yeah. Now, we talk so much about vaccines, but COVID, to some extent, we're going to be living with this thing. Let's talk treatments, because there's a new one. It's actually an old drug with some new promise. Is it fluvoxamine?
Yes,
Tell us
exactly.
about that.
So when we look at drugs, we often say, okay, what new drugs can we develop? But we look back at old drugs and say, do any of these actually have activity against the virus? So use programs and cultures to kind of get a sense. Well, fluvoxamine is an old drug that's used for OCD and depression. And it showed in the lab that it had really good activity against COVID-19. There was a trial done in the summertime last year, small numbers, but people's level of virus was lower. And then one of three big trials that's now reported, actually one that was run out of McMaster, but done in South Africa and Brazil, where they saw about a 30% reduction in hospitalization of people that were recently diagnosed with COVID-19 that got this drug. So, it has a lot of promise. It's a cheap drug. It's easy to get. If you can link it with testing for people that potentially aren't vaccinated to say, okay, take this drug if you're not vaccinated, if you have COVID-19 and have risk factors, that's fine. There's two other clinical trials that need to finish.
Mhm.
And I think if all three show an effect, this might be something that really does come out as part of our therapeutic regimen, which is awesome.
Okay.
Because again,
Absolutely.
we got to
Yeah.
prevent hospitals more than
Yeah.
anything else.
Right. Well, we'll continue to follow that and check in with you weekly. Infectious disease specialist, Dr. Zain Chagla. Have a great weekend.
Take care.